What's going on, everybody? It's Alex here from Aleks Physio. So today we're going to be chatting a little bit about cervicogenic headaches. So this is a type of headache that originates in your cervical spine, hence the word cervicogenic. And it typically affects one side of your head, and it can affect up to 4% of individuals, primarily between the ages of 30 and to 44. So basically what's happening here is there's a nucleus. It's called your trigeminal cervical nucleus, and basically it's a center. Nerve fibers are able to send messages, and they converge in this nucleus from your trigeminal nerve, which is one of your cranial nerves, and your upper cervical nerves, your first three upper cervical nerves. So this cervicogenic headache is basically referred pain that's coming from this nucleus, which is irritated or is just getting different kinds of sensory input and information, and that's causing the headaches to be felt primarily again on one side of your head into your forehead. You may feel it in the back of your eye, just kind of around one side area. And a lot of people who have cervicogenic headaches have that poor posture, the forward head posture, sitting for long periods of time, not really activating some of those deep neck flexors of their neck, are restricted in some ranges of motion, have sensitive or trigger point areas that are kind of around their suboccipital area, which is just below kind of the base of your skull. They have reduced range of motion in their neck. And there are some tests that you can do to try to determine or help increase the chances that the headache that you're having is coming from your cervical spine versus just having like a regular primary headache or a tension headache or a migraine. So in this video, I'm going to go over a few different exercises that you can work on at home if you've been having some of these headaches, and if you may think that it may be coming from your cervical spine or from your neck. But again, it's best to just go see a physiotherapist, and they can help to determine if there is anything else going on in there that you may not be aware of. So please don't take this as medical advice. The first one is an active upper fibers of trapezius muscle mobility stretch. So the way it's going to work is if I'm having symptoms on the left side of my head, then I'm going to mobilize the left side or the left upper fibers of trapezius muscle to try to help get more blood flow and more movement going into that area, since the upper fibers of the trapezius attaches kind of around the skull and the upper cervical spine area. So the way this is going to look is you're going to side bend away from that irritated side. You're going to rotate your head towards the irritated side, and you're going to do a chin tuck. So those three movements. Now, in addition to this, we're going to, instead of just doing this as a stretch, we're going to add some mobility. So I want you to try to maintain that head position and try to lift your arms up and come back down. Okay, so you're keeping that position and you're kind of working that muscle through its range of motion as you're coming up and as you're coming down. Okay. That's exercise one. The second exercise you're going to do, it's called the suboccipital release. So there are a bunch of muscles below the base of your skull called your suboccipitals. There's about 8 small muscles that can sometimes refer pain to your head and to your forehead. So the way it's going to work is you're going to take your middle finger, you're going to put it over your index finger. You're going to find the base of your skull, which is the bottom of your skull, and you're just going to apply pressure just to the side of the middle of your spine where your cervical vertebrae or the bones, your spinous processes, the bones of your cervical spine are. And you're just going to apply pressure for about 30 seconds until you feel a release, quote unquote. So this is where you can find it. So base of the skull is right here, just below, finger over finger, and I'm just applying direct pressure in that area. Third exercise you're going to do is just a chin tuck, just an exercise meant to try to strengthen some of the muscles on the front of your neck. So the way it's going to work is you're going to start with your head forward, and you're just going to tuck your chin as if you're making a double chin, and you're going to feel some of the muscles around the front of your chin swell up. You just want to make sure that you're swelling up the muscles that are deep in your neck versus the common muscle called your sternocleidomastoid that can get more activated. So we're trying to activate those ones, those deep neck flexors, versus kind of those superficial ones, or the ones that you can see. So chin forward, double chin, tuck. You can put your finger on your chin just to give you a little bit more cueing. Hold and relax. Let me know how that was. Let me know if that information was valuable. I hope that it was valuable. Thanks for watching. Please hit the like, comment, and subscribe button for future videos like this one that I've made here. And let me know if you have any thoughts or suggestions for future videos.